Bismillahirrahmanirrahim. Assalamu alaikum, everyone.
वालेकुम अस्सलाम।
Okay.
वालेकुम
Well,
अस्सलाम।
wa alaikum assalam rahmatullah. I hope everyone is doing good. I'm Dr. Madiha, and my friend and my colleague Dr. Shumaila is also with us. Both of us have started a small platform to help our friends and colleagues back home and even in UAE to help them, go through the clinicals of MRCPCH and to help them, achieve good grades in this exam. For this, we have started this effort, and I hope it will be helpful for all the candidates, inshallah. So, today we are going to give a brief overview about history taking. But before we move on to the history taking pattern, first we are going to discuss what is the strategy and timetable and how to start the preparation for this exam. Okay, so I hope everyone is ready, so I can then go ahead.
Yes, please.
Yeah, actually,
Okay.
we have three participants, and I think we can start with that.
Okay, okay, okay. So we will start with the strategy and timetable and how to start the preparation of this exam. So first of all, you guys, whoever are preparing for this exam, they will require a resource to refer to and to start your preparation with. The best book that is available and is coherent with the exam is Mark Beatty. Mark Beatty contains most of the information that is related to this exam, to the actual exam. So it is actually a practical book that will help you to learn different type of stations that are there, and it will also give you what criterias are there that helps you in clearing this exam. Okay, so Mark Beatty is a good resource, and as you will inshallah go along with us, we will share with you with some other guidelines and some other pieces of information that are helpful in this regard. But as for the beginning, I would like you guys to take a good overview of Mark Beatty, go through it, go through each section of history taking, communication, short clinical scenarios. That is really going to help you out in in picturing what kind of exam it would be. It's an easy exam, inshallah. No exam is difficult. It only needs a proper strategy, and if we inshallah go according to the strategy, things will inshallah work out very well. Okay, so in this group we are going to communicate, of course, in English. So it can be recorded, and if any person apart from our own nationality are involved in using this platform, they can also benefit from it. Okay, change the slide, Dr. Shumaila. Okay, so we'll come to the main thing, which is history station. So history station is one of the most important stations in this exam. It constitutes of 10 marks, okay, which after the development weighs the most marks in this exam. So the developmental station has more numbers, and then it is followed by the history taking station. So if you work hard on this, you can easily get full marks in it, because we know a number of candidates who score full marks in this station. Okay, so it's a long station, it's 22-minute station. 13 minutes are dedicated for history taking and 9 minutes for discussion with the examiner. Okay, generally you'll get a scenario outside the examination room. So when you're waiting for your turn, you will be given the scenario. So and you'll be provided with paper and pen as well. So you can actually jot down your differentials, and you can list down the headings of history taking before you enter. And I would highly recommend it, because you should do it, because once you enter inside, uh, of course you are in the pressure of exam setting. There are multiple people sitting inside. There's a role player, there's an examiner, there's another examiner who's observing the examiner and the role player. So because of that stress, you might miss out on some important, headings, which will of course cost you your marks. So when you're outside the station, make sure that you jot down all the history taking points and you are mentally prepared to meet the role player. Okay. So yes, Shamaila.
Yes, I'm just pulling the slide. There's a little bit.
Okay. Okay. So anyways, we are going to discuss now how you're going to plan this station. Okay. So Alhamdulillah, as most of you have done your post graduation or you have a good experience in the field of pediatrics itself, all of you are aware of, how we take a history. But it's important to, write it down in a proper order. So you will follow this order every time now you're going to practice the history taking. So it will inshallah help you in your final exam. Okay. So, okay. So Shumaila has also mentioned all these points that you'll read the scenario and you will write the headings as I mentioned, and you'll prepare few differentials so you can outline your history according to those differentials. Okay. So the first thing that is there is, of course, when you enter, you have to introduce yourself and you have to do a good rapport building with the role player, which is the father or the mother, and with the child himself. If the child is sitting, generally the child is not sitting, but if a child is sitting, then you have to make a nice, reputation with them. You have to introduce yourself nicely, and then you will start with your history taking. Okay, so the first step, of course, is introduction carries marks. Repo building carries marks. So you're not going to just go in and start history taking. No, you're going to introduce yourself. Hi, I'm Dr. Madiha. I hope you're doing well. It's nice to have you in our clinic today. And if the child is sitting, you'll know the child's name, so you can greet the child by his name, and maybe you can, speak a few words with him, and then you will come to the point that I have been asked today to ask in detail regarding the uh, issues that, for example, John is facing. So is it okay for you, Mom, to explain me a few things that I'm going to ask? So this is how you take permission also, and then you're going to start your history taking. So repo building is extremely important. Being empathetic is the most important thing in this exam. But I believe not only in the exam, in our life also, we should be very empathetic to our patients and their families, because those who are undergoing any kind of stress, they are always, uh, they are stressed out, and it is one of our duties as a medical professional to, help them ease out their stresses. Okay, so you have to be empathetic. For example, if the mother tells you, I'm really worried about, for example, his constipation issues, I'm really fearful that something bad might happen, then immediately you have to respond to the mother. Don't worry, mom, we are here to help you. I understand your concerns. Of course, we appreciate your worries. So that empathy carries a lot of weight in this exam. Okay. So after you rapport building, being empathetic, and after you have introduced yourself, you're going to move on to the first point, which is the presenting complaint. I believe you guys all are familiar with how we take the presenting complaint. Of course, you will take the history in chronological order. Which symptom has occurred before should be mentioned first, and then you go down with the symptom list, and then you are going to explore those symptoms. You all are well aware, if pain in abdomen is there, what will be the questions: aggravating, relieving factors, shifting, radiating, non-radiating, uh, and associated complaints, for example. Okay, but the important point here that I would like to mention is that you should try not to ask closed-ended questions, because if you are asking closed-ended questions, there will be an immediate deduction in your marks, because the answer sheet that the examiner is carrying, it will have a column where he's going to mention that closed-ended questions are being asked, and this is of course going to impact your overall score. So, for example, if mother is telling that the child is having vomiting, so you're not going to ask, okay, tell me the color of the vomiting. What was the amount of vomiting? Is the vomiting projectile? No, these are all closed-ended questions. So what you're going to ask, Mom, can you please describe to me the symptoms? Can you explain to me in more detail about the vomiting? Then she will open up. And generally, the role player, when he's given an open-ended question, he will answer everything together. So she is going to tell you she's vomiting 4 to 5 times a day. It is usually containing food. It falls away from the body. It is quite forceful. So all information will come in one go. So it's going to save time as well, and of course will gain marks for you as well. So this is the important thing in the presenting complaint section. I hope I'm clear to everyone so far.
Yes, it's perfect.
Okay, I hope Dr. Vajia, it's clear to you as well.
Yes, I'm enjoying a lot. Thank you.
Yeah, any
Alhamdulillah.
queries you have, you can write it down, then we can answer it also later. Don't worry.
Okay. Okay. So as you move forward in the presenting complaint area itself, you are going to do a systemic overview. That is an extremely important area of your exam because it is going to help you in sorting out your differential diagnosis, and it will help you to reach the differentials and the most probable diagnosis as well. So keep in your mind all the systemic inquiries that are there, starting from weight loss, loss of appetite, which is the general inquiry, and then moving on to cardiovascular, chest, abdomen, CNS, genitourinary, musculoskeletal, skin. So try to remember all the systems that are there in the body. Ideally, you're going to write each of them down. Maybe you don't need to write the symptoms, because once you'll remember the system itself, you will remember the symptoms. For example, if I've written chest, so I know I'm going to ask, is there any cough associated with it? Is there any breathlessness? Is there any color change? Okay. So these questions will come to your mind automatically, inshallah, once you're in practice. But systemic review is the most important area, so don't forget it. A lot of people, they tend to forget it and they remember it later, and they can ask it later, but then you'll be scored as having a unplanned kind of a history, so that also goes for the deduction in the marks. Okay, it's better than not asking, but of course if it is non-systematic, they're going to deduct. So you have to be professional, you have to go in a systematic way, so the examiner knows that what you are thinking and what you are what you're thinking about. You're just not asking questions randomly, rather you have a plan, you have a differential in your mind that you are trying to dig out. Okay, so that is about the presenting complaints. And then if it is an acute problem, you can ask what treatment has the child taken for it as well, or any consultation has been done for it. So you can ask it in the presenting complaint as well. Okay, but if it suits you, you can ask it later also, but I prefer, because it's in continuity with the symptoms. So if child is having vomiting, so I can ask, have you taken any treatment for these symptoms? So she can tell you, yes, I have taken some over-the-counter domperidone, but it didn't help. Okay, so like
Actually,
this.
one thing just
Okay,
I want to add at this point, sorry to interrupt you, because as Madhya was telling about, you ask about the treatment also, because once we are asking about any complaint, aggravating and relieving factors, so at that time also, because they will tell us like we will give some medications and then it's get better. So that point, there is a point we can ask about, okay, so what treatment is being given and since how long? So that's what we can discuss a little bit of treatment, as they can mention it as relieving factors.
Yeah, that's correct. Thank you, Shumala, for adding. Okay. Then after the presenting complaint, we'll move on to the past history. Okay, so now you're going to write it down. So you're going to write presenting complaint, then you're going to write systemic inquiry, and then your third heading will be past history. In the past history, you're going to give a very open-ended question to the mother. Is there anything significant related to his health that you would like to mention, or anything significant in the past that you would like to mention? So if there is anything significant, it would be mentioned to you. If there was any hospitalization, any surgery, any transfusion, this simple question will cater to all these areas. So you are going to ask, is there any history of any significant past illnesses? So the mother will tell you, yeah, he's been having on and off vomiting. We were hospitalized once. and she will give you the details. And if she says like that, that you can ask, can you give me the details of the admission, please? Okay. So again, you are going to keep your question open-ended. Yes, Shumaila, you want to add something?
No, yeah, you can carry on.
Okay. Okay. So that is related to your past history. Then after past history, we move on to the birth history. Birth history is extremely important, irrespective of the age of the child that you are getting. Okay. For example, it might be a 13-14-year-old child, but birth history is still important because this is your history taking station. So you cannot just, overlook it. You cannot just say, okay, now he's 14-15 years old, I don't need to bother much about the birth history. No, because every area that you're asking is carrying some points. Okay. So birth history is important. And of course, if anything significant is there in the presenting complaint, for example, there's a history of seizure, or uh, there is any neurodevelopmental concern that the mother has shown you, then the birth history will have a very pivotal importance. Okay. So in the birth history, you will again divide it into antenatal, natal, and postnatal. uh, Again, you're going to give a very open-ended question to the mother. If you know the name of the mother, it's better to call her with her name. But if you don't know, you can say, okay, mom, can you please describe to me your pregnancy and birth details? Okay. That is a simple question that will cater to everything, and she will mention most of the things. If she fails to mention a few things that you want to ask, for example, you want to ask about any addictions, for example, any smoking or alcohol intake, then you can, in a very polite way, you can ask that it's extremely important that I should know if there were any addictions during the pregnancy. Then she can mention, yeah, I was smoking, or I'm alcoholic. So she can mention that. But most of the details, she's going to give it to you by herself once you give her an open ended question. But if you're going to ask, okay, so how many weeks was he delivered at? Then she will say, okay, he was delivered at 36 weeks. What was the mode of delivery? Then she would say it was a cesarean section. Why cesarean? Then, the questions are going to pile up, and that's going to consume a big slot of your time, which you don't have. So you have to go on with a very uh, yani strategic way of asking questions. So you ask less and the mother can give you more input. Okay. So you're going to ask about the antenatal, natal, and postnatal. Once we will be discussing the case, we will discuss about the what important points are there in the antenatal, natal, and postnatal. uh, but roughly, I suppose all of you are aware of it. And once we'll be doing a proper mock, we are going to discuss all these points as well. Inshallah. In this history, the birth history, I want you to put a small heading of newborn screening and hearing screening. Okay. This must be asked in this area itself, because if you're going to miss it, you're going to miss it. And in most of the histories, it carries a lot of weightage. For example, if it's a case of cystic fibrosis, newborn screening is extremely important. If it's a case of a metabolic disorder, again, this piece of information is extremely important. Similarly, hearing screen, because worldwide newborns are screened for it, you should ask for it. Okay. So these two questions, make it your yani habit to ask these questions. Okay. So that goes for the birth history. Then just remember, after birth comes vaccination. So I like to put vaccination and allergies after that. So immediately after birth, you can ask the mother about the vaccination details. So you can ask, can you give me the details of the vaccination? Or is the child vaccinated up to date? So the simple answer will be there, yes, he's vaccinated up to date. Then, if the case warrants you to ask for any specific vaccination, for example, if you feel this is an immunocompromised child, or if you already know this is a child with cystic fibrosis or with any other chronic illness, then you must ask for other optional vaccinations that are important in regards to that scenario itself. Similarly, if it's a case of a preterm baby, you have to ask about the RSV vaccine. So these questions will be tailored as per your case. So you're going to ask about the vaccinations and allergies. So vaccination has separate point, and asking about the allergies carries separate point. So never forget to ask about the allergies. Okay, you can ask about any skin allergy, food allergies, any kind of allergies that the child might be having. Okay, any medicational allergy that he might have. Okay, then you will move on. After birth comes vaccination and allergies, and then after vaccination allergy will come your
Growth and development.
growth. So generally in this area, what we prefer is we mention growth, development, diet, and puberty. I want you to put slash, 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 and put all of these headings together. So you don't forget any of these, because generally when we tend to ask about growth and development, we forget to ask about the diet. It is extremely important to touch that area as well. Sometimes we forget to ask about the puberty, because you might get an adolescence in your exam and you have to ask. Okay, so this is extremely important that you should put all these four headings together. So growth, development, diet, and puberty, all in one go, so you don't forget any of these areas. When it comes to the developmental history, it's a very detailed history, and you have a separate station for that. That's the longest station. So they expect you to judge you on your developmental area in that station. So generally this area you can just simply touch upon it. Okay, so you don't have to go in a lot of detail until unless the case warrants so. Okay, so you can simply ask the mother, are there any concerns regarding the growth and development of the child? So if she says everything is fine, then it's okay. But if she says that okay, I believe he's not speaking much, then you can explore a bit in that area, so you can just know what is the developmental age of the child. So you can ask how many, when did he start to say the first word, how many words can he say at the moment, how does he communicate with you. So these short questions and not much. Okay, is there any concern with hearing? So again, now you see, if you asked whether the hearing screening was done, will help you in this area as well. That's why it is extremely important to ask it in the birth history itself. Okay, am I clear to you?
Yes.
Yes.
Okay. Okay. So then again, puberty. If your child is adolescent, you have to ask about the secondary sexual characteristics, and you can ask it politely that generally at this age, children's body, it undergoes certain changes, and they can develop axillary hair and pubic hair or breast development. So are these changes happening for your child? So the mother of course will be aware of it. Okay, so even if she's not much aware, and if she says, oh, how would I know, something like that, then you can say, okay, we will see it on examination. So no need to get offended if the mother says like that. The important point is that you've touched this area, and that's all that the examiner wants to see. Okay, and then diet. Now in the diet, especially if it's a case of faltering growth, you must ask about, can you tell me what he takes from morning till night, how many meals, how many snacks. Okay, so you can have an average idea of caloric intake that he's taking. And then you can specifically, if it's really a case with faltering growth, then you can ask that, have you taken any consultation with any nutritionist or dietitian in this regard? Is he on any supplements? Questions like these that will be relevant to your case. So you have to at least touch this area. Okay, then after growth, development, diet, and puberty will come the family history. Now remember that the family and socioeconomic history holds extreme importance in these exams. Okay, it is said that if you are still on the presenting complaint and the examiner has given you the first warning bell, you should leave all the history and you should jump directly to the family and socioeconomic history, because the weightage of these questions is extremely important. So always try to reach these areas well in time, so you can explore, because there's a lot to ask in these areas, and maybe you might need to ask some closed ended questions to explore it more. Okay, So when it comes to family, it is simple. Few questions will do. For example, you will simply ask, can you describe your family to me? Then she will tell, I'm living with my husband, and I have two children, and they are fine. And then you can ask any significant illness in the family, any similar illness that you are investigating in any other family member. So questions like this are suffice here. Okay. Then when you come to socioeconomic, the questions will be more detailed. So when it comes to socioeconomic, so you can see in the slides also, you have to explore areas, and I want you to put separate headings in the social history for home and family. Then the second heading for school and friends, and the third heading for disability allowance. Okay, so these three headings must be there and they must be covered. Okay, when it comes to home and family, you're going to, of course, ask, can you describe your home to me? How many? So she will tell, this much rooms are there, how many people are living. Okay, so the details are going to come from the mother's side. So ventilation of the home has to be asked. If it's a case of any developmental delay, you have to ask, any special changes have been made in the home in regards to the child's needs. Okay, so these questions will of course be tailored according to the case that you are dealing with. Okay, similarly, you must ask, in case of chronic illnesses, who's helping the mother? Okay, is there any support system that they have? Are they getting any respite care? Respite care is when, the parents are so much engrossed in care of a chronically ill child, they don't have time for each other. So in foreign countries, the government will provide respite care in which somebody can take over the children for, a couple of hours, and parents can have time, quality time with each other. So all these questions, they carry a high weightage in the exam. So these are regarding the home and family. And of course, you can ask about the impact of the child's illness on other family members, on other siblings. Okay, psychological impact, okay, of the illness, child's illness, on other family members and on the siblings. That is also extremely important. So you must ask these questions. When it comes to school and friends, you must ask regarding the school, which grade is he in, how is he in academics. Okay, then you can ask about his friend circles. Does he like to interact? How many friends he has? So you will have an idea what impact the disease is causing on the psychological status of this child. Okay, and then whenever there's a chronic illness, you have to ask about the disability allowance. And not only that, you have to ask about whether they are involved in any social groups. Okay, and do they have an emergency management plan, a written emergency management plan? This will go true for any child with asthma, with epilepsy, with cystic fibrosis, um, with cerebral palsy. So they should have an emergency management plan to deal if some situation happens at home. And not only at home, at school as well. For example, if it's a case with an anaphylactic reaction, the school must also have epinephrine, and they should be aware that he is allergic to this. For example, he's allergic to peanuts. The teacher must be aware that the child is allergic to peanuts. Okay, and they should have epinephrine and other emergency management available at the school as well. So these areas are must to touch when you have a child with chronic illnesses. Okay, and of course, then you have to ask about, in the social, you will ask about the earning members, any addictions. It is extremely important. You have to ask whether the father or the mother are addicted to certain drugs. You have to politely ask about any uh, physical or this trauma, physical trauma, or what do we call it, social abuse that might be happening at the house. So you must be aware of it because it will impact the child. A lot of children with speech delay can have a background history of abusive relationship between the parents. Okay, so you have to ask politely about these areas as well. Of course, if you will ask about pets, if it's a case of chronic allergies, anaphylaxis, and you will then, then your history will tailor according to each case. For example, if I have a case with chronic asthma, I have to ask about the curtains, carpets, about the pets in the house, smoking specifically. Okay, so these questions will of course tailor, but that is the rough overview that you will generally have to take. And side by side, when you're taking this history, I want you to write down your problem list as well. What is problem list? Is what concerns the parents the most. Because when you will be discussed about the management of this case, if you fail to touch the area that was most concerning to the mother, then you'll probably not clear this station. Okay, for example, if it's a CP child and mother is now concerned about the spasticity, and you did not cater to that area, and you were catering to the epilepsy area, and you were catering to the GERD area, and you were catering to the psychological impact and other things, but you failed to answer the first concern that the mother had was the spasticity, then you are not going to clear this station. Okay, so that is very important. You make a problem list. Whatever is the problem list, you're going to answer that in your management plan. So in your management plan, we will discuss it later because it's not the part of the session, but when you're taking the history, simultaneously write down what concerns the mother the most. That area must be touched when you are going to do the management plan for this child, inshallah. Okay, so that is the brief overview. If there are
Thank
any
you so much,
questions,
Madhya, and thank you so much, the guys. Actually, the session is like now it's just a minute left to end this session, but I want to like somebody ask for because